Tim, you were quoted in The Australian, I think it was this week, saying that our planet is a more dangerous place than ever before. Can you unpack that a little more for us? And then I'm going to ask each of our panellists who have a different lens on this, their thoughts on that statement.
Well, I forget what I said there, and it is the Murdoch press, so they might have got me wrong. I was trying to say in the lecture that when we say things are terrible, we do need a historical perspective. 2 world wars, my father fought in New Guinea, and I remember when I was complaining at, 17, 18, with a paper round, getting up early, he said, "Son, I was dodging Japanese bullets in Papua New Guinea for 2 shillings a day at your age. Stop complaining." And whenever we say things are terrible, we do need some perspective. So I'm not quite sure what I was talking about there, but certainly the nuclear element has raised the odds, and we know that the Russians control one of Ukraine's 4 nuclear reactors. We know that this precipice is terrifying, and that is a very scary element. I was thinking with the China threat, and we're all very focused on that, and we need to be prepared to resist, and how can we even trade and cooperate, given Tibet, Hong Kong, the Uyghurs. It did strike me that Whitlam went to China in 1971, when we applaud that, Nixon in 1972. That was just halfway through the Cultural Revolution, and tens of thousands were dying. So when we say human rights abuses with China, we can't ever do anything, that was terrible. And now we would applaud Nixon, Whitlam opening up. So, perspective is always hard to quite grab, but I would say the nuclear and the climate change threats are certainly profoundly different of past times.
Eric, you've been at the coalface of many of the big stories. How do you view, that statement?
When I came back from overseas last year, I felt a real sense of entropy, like having been in countries that are pretty messed up in some ways and places that are pretty messed up. And I did feel like everything was kind of falling apart. But since then, perspective, as Tim said, is so important. And actually, I thought about the fact that there are many foundations that we take for granted now, but that actually took a lot of work to lay in terms of how people cooperate, how governments deal with each other, how organisations work across borders and deal with each other, all of which make access, aid, assistance easier and more streamlined. If you have a look at the response to the initial Russian invasion of Ukraine, I have a friend who's a doctor based in Israel. He went to Poland straight away. They had buses, they had medical aid going in, they had clinics set up, they had Polish people picking up people from the border and taking them to their homes. Everything made possible through mobile phones, social media, that kind of recruitment. And the foundations of, just awareness of the event, responsiveness of organisations, community information, and also community willingness to become involved. And all of those things enabled a very quick humanitarian response. And that's astonishing. And I don't think that's happened before. So while things might be more dangerous, our capacity to respond is actually better. And that gives me a lot of reassurance, because I got young kids and I didn't like the feeling that the world was falling apart for them. And I think that actually some of your speech really resonated with me, because the capacity to respond, and I know Len and Paul better talk better about it than I can, but it actually is amazing when you see it.
And Len, that is your area of expertise. How do you see that?
Look, thank you, Jess, and I was inspired, Tim, most definitely, almost as much as Uncle Lewis's talk about the wood. I'm going to talk to people up north about that. But quite seriously, we are in a dangerous time. There's absolutely no doubt about it. And if we don't take note of that dangerous time, then we're overlooking the opportunity to do something about it. Fearless Focused Friends, and I'm stealing from Flinders now, can do something about it. It's about respect and about relationship. I headed up the first Bali response, bringing people back to Australia, 88 young Australians innocent, die at during the explosion. That was a seamless rescue, resuscitation, then repatriation across the nation. But it changed Australia's innocence in many, many ways. We were the beloved people who went to Bali on a regular basis, and some had the bintang, others had other things, and we were just sweet people, and we were loved by all. But all of a sudden, we're part of the 202 dead and all the others who are maimed and injured. It's prophetic that 4 weeks yesterday, it is the 20th anniversary, 2 decades since that first tragedy. On Sunday, it'll be 21 years since 9/11 happened. And I guess some of you will remember when kids used to be able to go up to cockpits and stand there with the pilot, and things are a lot different. There weren't screening. We lived in an innocent world. But with WHO, we've been looking at things like sudden onset disaster was one of our prime issues, whether they be man-made, natural, or conversely, combination of both. We looked also then and realised the importance through COVID of infectious disease. Yes, we'd been through HIV/AIDS, we'd been through, in part, Ebola, and they're still around, but all of a sudden we're dealing with something that in the early part of last century was an important issue. And in a perverse way, it unified the world. And I use the word perverse for a particular reason. There was a good side to it, as Reverend Costello said, because people came together, but they didn't maintain that momentum. But on top of that, there is also the territorial instabilities, the issues that are occurring in the Ukraine. I was up in Geneva only about 12 weeks ago, and the flow of refugees, displaced people, 8 million, 7 million moving from to Poland, to Romania, and to one of the poorest nations on earth, Moldova, takes 1 million people, 1 million. Now, they're displaced, and there's a tragedy involved, and of course, climate change. And what climate change is actually doing is quite phenomenal. It does threaten the Indo-Pacific region. Barney Marama only a week ago spoke about it on Twitter, and if you look at his Twitter account, you'll see the fairly sage comment he made about our transfiction, or our ability to stay with fossil fuels rather than renewables. All of that, and Tim touched on it as well, has a ripple effect as well. There are people who are displaced. There are people, the Rohingya people, 1.5 million in a camp at this moment, tonight, when we sit here, living in abject poverty. There is the Horn of Africa, which is a ripple effect of what is happening to 1/3 of the grain population that would be coming out of the Ukraine normally. There are fuel problems. But in our own country, floods, fires, and so on. So over the last 2 years, I've had the true privilege of having 26 deployment teams responding to everything from the tragedy of measles in Samoa, 20% vaccination rates, and little children dying in front of them. Quite a heartbreaking event. The bushfires in northern Victoria and southern New South Wales, the events with respect to the White Island disaster, and then 22 deployments in terms of what's happening with COVID. And not forgetting for one moment those people who are sleeping rough down the street here a few blocks away. Not forgetting our First Nation people, not forgetting gender inequalities, not forgetting the disability, the individuals with disabilities, the young, the old, and so on. That's the precarious nature, but we can, through relationships, friendships, through respect, we can do something about it. And I wind that off. When good people do nothing, bad things happen. And that's been attributed to about 15 different people. I might as well say it can be attributed to me as well, but nobody quite knows who actually said it. But thank you.
Thank you, Len. Paul, is our planet more dangerous than it's ever been? And through, how do you view that?
Well, I guess it's a really interesting question, because I think that we became very good, arguably very good, at responding to particular events, to particular kinds of emergencies. And We've seen that in this country and across the globe with wildfires and earthquakes and floods and various events. And we can always criticise those responses, but they've gotten much better and more effective. But in my view, that's not the problem. The problem isn't the kinds of challenges that people in their communities have to face. It is the problem of the complexity and interdependence of our societies today that means that it isn't the event that's the problem. We can respond to the event. It's the damage that that event does to all of the other systems, if you like, that we depend on to be safe and to be healthy and to be prosperous. So today, what's different? I guess today we see social cohesion is more difficult to sustain. Trust in governments in particular, or trust in science, for example, is waning, and that makes it harder for us all to respond to emergencies, but also, obviously, to prepare well for them, because we have to work together to do those things. We have to respond together. We have to trust in the responses that people are recommending. COVID-19 has been a great example of that, of course, because we've all been challenged about whether the vaccine is safe, whether masks make a difference, whether lockdown is the best thing to do. All of those questions are good questions and obvious questions that we would all ask, but they do challenge trust and social cohesion. And so lastly, I'd say the thing I think really has changed, the new threat, if you like, for me, is living in the modern information ecosystem, because it's the core of all of that problem that I'm talking about. We all live now in an environment where we have access to so much information all of the time in volumes that we can't process, and that access to this information ecosystem that we live in today has been truly beneficial and wonderful. So, I was able to park in a car park quite close to the venue in the rain because of the information ecosystem that I live in. Right? Much of medical and healthcare has changed because of that kind of information. But the problem in the context of crisis and conflict and disaster is that there's too much information, and it's incredibly difficult for all of us, even those of us with some experience, to work out which piece of information we should trust, what we should actually do, which source is most reliable. So the information piece is really challenging these days, and I think it starts to unpick our ability to function as a society in crisis. So I think information is one of the new threats, and it's those threats underneath. It's not the fire, it's not the flood, it's not the earthquake. It's the stuff we need to deal with it, and the information that are the real challenges for us today, I think.
Yeah, fascinating perspective. I want to come back to climate change. It's at the core of a lot of the discussion tonight. It's been a historic day for climate change in our country with the passing of the Climate Change Bill late this afternoon in Parliament. Tim, you've spoken about climate extremes becoming a key force behind world hunger. How do we convince global leaders that the time is now? How do we galvanise all of us to action on this?
Yeah, so we know that we've got a very great political challenge. Most politicians absolutely would go. We should be acting, I accept it's real. But the costs imposed, I won't see the benefits till 20 years' time, and I'm not running in 20 years' time. I'm running in 3 years' time, and this is, what the electorate expects. So we've got this asymmetry of politics being able to address the challenges. Now, I went to Copenhagen, and I was there as World Vision CEO because the impact of climate change is so disproportionately hitting the world's poor at the moment. And that inequity, because of the relational inequity of allowing them to be in poor, where they live almost determining whether they live, means that they're on the worst land, the most marginal land, the land that floods and is destroyed with climate change already. And the Pacific is, the wake-up call about that here in Australia. But we know that It's very hard for any leaders in the West to say a carbon tax, which would be the most obvious way to deal with this, and reduced lifestyle when you have expectations of how you live now, can survive the political test for others, whereas the developing world, the majority will. They're really saying, well, who owns the sky? You in the developed world have your standard of living because you put so much carbon up there. We have a right to development. We therefore need differentiated rights to put some up there, and you have to cut and sacrifice. And the politics of Western nations is we can't survive politically if we ask for that sort of sacrifice. So it's a very wicked problem that we've got. But this is where, if we won't address this for future generations, this is a big moral fail.
We've seen such swift action in response to COVID, both domestically and internationally. How do we find that same sense of urgency to address the big issues like climate change and global hunger? Len, can I hit you up with that one?
Yeah, look, I think that we take the low-hanging fruit, in a sense, the simple solutions. Our relationships with Fiji, Vanuatu, the Pacific region, and indeed various parts of Asia as well, is very close. We're very close to Timor. We do a lot of work with Timor. And in building friendships, building resilience there, which is a big area that Paul's working with, really solves part of the issue of tackling this huge problem. First of all, we respect the locals, respect the people. Say, let's take the Pacific, for instance, respect them. Respect the fact that they live in what is called the Ring of Fire. That's earthquakes, that's SBY, Susilo Bambang Yudhoyono said to me about 10 years ago when he was president of Indonesia, Len, we've got a disaster warehouse. It's a supermarket for disasters here. We can have anything from person-made disasters through to earthquakes, fires, you name it, we've got it. Okay, that's true. But if we listen to the locals, listen to what their issues are, and help to resource them in a capacity manner, without it's actually being clever about the response, rather than saying, look, let's resuscitate AusAid and put $400 billion into something, but rather let's very carefully and cleverly work with the people who are most at risk and build for them a sustainable future, a sustainable community.
Terrific. We've got some great questions coming in from the floor, and I'll call a couple out while they're kind of relevant. What role do you see of health professionals and government health departments to address climate change? Who'd like to tackle that one? Thank you, Paul.
I'll have a small go at that. I think it's, I don't know who said that everything is connected, but I think it was Yoda, but you can correct me about that. But everything's connected, and for health, climate change is one of the critical issues. It's a critical issue for a couple of reasons that are poorly understood. One is, of course, that heat waves, extreme heat events, have really interesting health effects, and the impact of a heat wave in terms of patient presentations to healthcare is mostly in the 10 days after the heat wave has finished. And we don't understand that. We don't understand the volume of that problem compared to any other natural hazard event that we see in communities around the world. Heat wave is the most dangerous disaster. So health has a big piece to play in that space. The other one I think that is really interesting is that some of the things we've talked about with respect to increasing poverty and difference and lack of cohesion and all of those things that happen in a community cause people to live closer to the environment perhaps than they did before, cause people to live closer to deteriorating environment, to climate change affected environment. And we do know, as with COVID-19, I'm not saying COVID-19 is an example, but we do know that novel and emerging infectious diseases are directly connected to people living closer to degraded environments. So climate change and the next pandemic are connected, right? So for health, this climate change space is really important. What we do about it is an interesting question. I think we used to, in the days of the early days of the concerns about nuclear Armageddon, health professionals took a much stronger advocacy role in arguing that the world should be different. And I think the health professions have an opportunity to step up again in terms of leadership and talk more about how communities should face some of these problems, and indeed to help people understand how they actually work. So yeah, big job to be done.
Just on that interconnection that you mentioned, Paul, are we prepared for that? And what does that mean for our policymakers?
It means that the stuff that breaks during crisis is not necessarily what you expect. We see now cascading and unexpected consequences in the terminology that we use, so that it isn't the power failure that's the problem. It's the sewage in the street because the pumps are controlled by the internet protocol that is not working. It's the ambulance system running out of fuel because they're using fuel cards because they don't have their own pumps anymore. All those kinds of stories are about the complex and interconnected systems that we've set up. So for our politicians and policymakers, it's really a question about understanding how to improve the robustness and the capability and capacity of the systems that we depend on every day, whether that's healthcare or it's education or it's communications or it's supply. Or, are those systems able to take a hit, really regardless of what that hit arises from? Doesn't matter whether it's a power failure or a flood or conflict. But the systems need to be more robust so that you are less damaged and survive better through the event and recover faster. Right.
Thanks, Paul. Another question from the floor, and Eric, you might be able to answer this one for us. How does the general community help influence our government to support broader world crises such as the famine in Africa?
Oh, I love this question. Yeah.
Had your name written all over it.
I was hoping we could talk about this because, one thing that really struck me being overseas is the difference between countries that get the politics right and those that get the politics wrong. So countries that have accountable politicians, accountable leaders, open policy systems where the public understands why decisions are being taken and they can question those decisions, they did better. In COVID-19, where there was high trust in government, they did better. Where systems were more resilient, they did better. And there was less civil unrest and there were fewer problems. And I also noticed this before COVID, when you're talking about issues in the Middle East, the public is often way ahead of governments. I mean, how many people here tonight think we should, make our ties with Saudi Arabia closer? I'll give that an example, yet the government does. We're still doing military exercises with the Saudis, despite knowing what they did to Jamal Khashoggi, the journalist, or despite seeing what young women were doing to escape Saudi Arabia. The public's way ahead of the government on a number of issues. And the government, in my experience, tries to work out ways to ignore that. Simon Birmingham, an Adelaide based minister, at the last election admitted in his post-election interview, the public was way ahead of us on gay marriage. And that plebiscite, we knew we were just wasting everybody's time. And I thought, bang, there's a big truth bomb, from a government on the way out. And that is what, unfortunately, governments I've seen keep doing what they're doing because it's hard to change the course that they're on, except when there's significant, enormous public pressure. And I think public advocacy really, really works. Since I've come back to Australia, I've sort of been like, why aren't people more fired up about this stuff? Because it works. When you do it, it works. And in countries where politicians are more accountable, pressure's really, really effective. And, when something becomes a big story in the media or it blows up in some way and a politician has to deal with it or is embarrassed by it, suddenly you have a government that's more willing to change because it's taking hits, it's taking damage. And it's really within most people's capacity to organise, to advocate, and just to make their politicians feel a bit uncomfortable about stuff. And I'd really encourage you to do that.
Great advice. I'm going to quote Tim again here. Access to nutritious food, education and healthcare so people can live in freedom from want and fear is the definition of true global peace. Len, I wanted to ask you, speaking from a health perspective, what should relatively wealthy nations like Australia be doing to support those of less means?
Look, it comes back a little to what I was saying before about partnerships and about establishing, assisting those particular nations to become more resilient. And if I use the example in 2010 of Haiti, and it's one of the things not to be done, a lot of very well-meaning people threw a lot of very well-meaning money at a very wicked, terrible problem that 12 years later is still a very wicked, terrible problem, probably made worse by a group of very well-meaning people who came in and became a burden on the community. My outfit basically works on the premise that we don't become a burden on the community. We're completely self-sufficient all the way down to desalination of our own water, food, accommodation and so on. So we don't go in looking to stay in a particular hotel or whatever else. We have our own accommodation. We did it in Pakistan 2010, we did it 2013 in Haiyan when that dreadful typhoon came through. But the point behind it is to understand what is appropriate. The local people will tell you what is appropriate for them. And I often say, because if we say to a particular nation, what do you need? It'll be a case of money, guns and lawyers, send as much as you can right now. Then you talk it down to what is appropriate and what happens. And one of the most wonderful things with Cyclone Gita in 2018 was that I was asked by Vanuatu to send a team up, and we did send a team up. And that team was then told, or I was told, you can actually bring the team back because you've actually trained us over the last 5-10 years and mentored us in the way we best respond. And we'll keep one of your command and control people, but we don't actually need much else. And I think that is the secret of success. It's the low-hanging fruit I spoke about right at the beginning. There are solutions out there, but often we look at the complexity of the situation and are confounded by that, and it's just too big. A colleague of mine often recites how do you eat an elephant? You eat them with a teaspoon, one bit by bit by bit. Now, she didn't make that up. Somebody else made it up a long time ago. But it's tackling, but be fearlessly focused, and I say that again.
Tim, would you agree with that?
Yeah, totally. And I mean, you and I have both gone to disasters, and you have this interesting stage where you almost have the humanitarian cavalry who ride roughshod in, take control, make sure the water's clean, and you've got to withdraw them pretty quickly and have then the development people come in and say, actually, what's appropriate? How does this work? There are moments where you need the humanitarian cavalry to stop cholera breaking out, and they do trample, on what should be the locals' decision. So you have balances in this. But to go to, I think, Eric's point, we have got a whole lot better at this. Haiti is a disaster. And if you go back and look at the history of that burdened country because they had to pay reparations to the French for slavery, how they are really the most cursed nation. Just about everything that can go wrong always goes wrong in Haiti. The tsunami, which I think you reported on too, we had the madness of just about every group deciding, even though they'd never been outside Australia, deciding to pitch a tent, go up there, utter chaos, leading to a review where the UN literally said, only if you've got capability and experience can you go in. So you don't ever want to cut off the charitable need to help. That's a nice thing. But the havoc that it causes and the trampling down of people's own sense of this is our place and our capacities, totally agree with that.
Can I tell a really quick story?
I
got myself stuck in the earthquake zone in Papua New Guinea in 2018. I got a helicopter ride up there and it seemed like a good idea because it was such an important story, but then of course I couldn't get out of the earthquake zone. But I found myself in a meeting after a few days. I'd kind of run out of stories and places I could go. And I found myself in a meeting of the local sort of committee, the mayor, the police, and a guy from the company Oil Search who was running a health program, but he just ended up coordinating this local meeting. And he said, why is the power still off? We're like 2 weeks after the earthquake. Why is the power still off? And they said, there's a line down about halfway along the road to Mendy, which was about 40 kilometres out of town. And they said, well, we've got electricians here, like we could just reattach that line, right? And they said, no, we haven't got a ladder. and so the town had been without power for 2 weeks.
Wow.
Because and then he said, and then they sort of went, well, who's got a ladder? And then they asked around, and someone made some call, and then because the mobile phone tower had a generator, and all of a sudden we got a ladder, we got a truck, and then the guys headed out, and then the next day we had electricity. So actually, it just took someone asking the question, doing a little bit of coordination,
Job
and then
done.
Electricity got restored. It was astonishing.
Eric, you've seen, no doubt, the inequity firsthand. Is solving hunger the key to safer, healthier and more functional societies?
Yeah, food security is absolutely paramount because it's the primary. So water with climate change is going to be such a big issue. You see it in so many places. I did a story on it last year about the Middle East, so when I first got to Papua New Guinea, there was a El Nino drought. And there were hundreds of people dying in the highlands of Papua New Guinea, and it's really hard to quantify exactly how bad it was because Papua New Guineans are pretty resourceful and resilient. But it wasn't the first time it had happened, and it's going to keep happening, and we know it's going to keep getting worse. But when you have food, when people don't have food, and when people don't have water, then violence increased. And people think Papua New Guinea is really violent, but it was simply the fact that people had to go from, say, their village where they had a stream, they had a water point, and they had to go look for water in someone else's village, and then people were like, don't take our water, and then you had violence, you had increasing attacks on women and girls because they're vulnerable, they're outside their communities, and you just see the flow-on effects of these problems, and they're much more than just, not much more than just environmental, they're social too.
You mentioned resilience, and Paul, I wanted to ask you, how would you define the concept of resilience? It's your area. After hearing Tim's address, is it about simply surviving, or is it more than that?
Well, it is more than that. I was going to say I don't know, because there are so many definitions of resilience, really, but it has a long history, and it obviously is a term that started back in engineering and in ecology, and it was about bouncing back, getting back to where you were. But today we wouldn't think about it like that. We would think about building resilience as being about building the ability to adapt and to be flexible and to survive better through an event and develop a new way of doing things after the lesson that you've learned from that experience. So not building the same bridge back, in a crude example, so that it can be washed away again, but actually trying to do things differently. So resilience is that ability to survive better through and recover faster from events. Yeah, very personal.
Yeah. Thank you. Len, you touched on it being 20 years next month since the Bali bombings. You've been at the forefront of so many events and disasters since. How have you seen change, and what does that mean? How have you seen, I guess, these events change, and what does that mean about our responses to them?
Jess, we as a nation should be very proud of what we've achieved. The models that we've put into place, and I use the AUSMAT, the Australian Medical Assistance Model, has been adopted by WHO. In fact, we here in Australia wrote the so-called Blue Book, or the Blue Book of Accreditation for emergency medical teams, which again comes out of the Haiti debacle, for want of a better word. We've also tightened up our databases so that when the cavalry, in inverted commas, arrives, we can distinguish them from our own people who are AUSMAT trained. One of those being Harry Harris, who went up wearing an AUSMAT shirt to save those 13 lives in Thailand a couple of years back. Now, by doing that and by distinguishing when to come in and when to come out, that's been extremely important. Excuse me. and have an accreditation process that we not only practice ourselves, but we train, mentor and give to others. You'd probably all be astounded that when the US Marines arrived in Darwin several years ago, we were asked to train their shock platoons, their response platoons, in immediate emergency medical aspects. One would have thought, coming from one of the most prominent nations on earth, this would have all been done already. But we built a huge relationship and have been greatly respected. So over that time, particularly the last 20 years, and it has developed. And so too have relationships, our relationship with Bali, our relationship with Timor, Thailand, and of course the Western Pacific, Fiji, etc., etc.
Eric, you've seen the personal impact of global events on people. Has there been a shift, or is it more the case than ever that global is local?
Well, let me think about that. I do feel like things are both more connected and less real. So, and by that I mean Paul's point, we know more than ever, we see more than ever what's happening, and as a result, we feel less connected to it. So I feel like the things I've seen are real because I've gone and met those people. I've seen, those people die, or I've seen, the results of conflict or whatever. So I know it's real and you really feel it. But when there's so much content, when there's so much information for an audience, it's not real, right? Like you guys, you see it, you get compassion fatigue. It's hard to keep caring because you see it more than ever. Social media brings those pictures to you more quickly than you've ever seen them before. The news is there, the satellite, the internet, like it's bang, you see it. So I feel like, sure, you know about what's going on the other side of the world, but you don't feel it. Like you're less likely to care or act on that because you know that next week something else will be happening somewhere else in the world. So, Tim can tell you about the Horn of Africa and it's horrific, and it's such a problem. And in the 80s, you would not only, by the time that got to you, it would have built and you would have felt it. And the world responded. And now, sure, we feel it, but we feel it momentarily because something else is going to come along and take our attention.
Yeah. We've got just a couple of minutes left. I'm getting the little wind up on here as well as plenty of questions. But I wanted to get some closing remarks from each of you. How do we all contribute as individuals to finding this alternative story that Tim mentioned to us earlier? Paul, can I start with you?
Yes, I do think that we tend to fall into the trap of expecting a top-down approach to the problems we see in our world. And I am a bit of an optimist, I think, which comes out of the experience of disasters largely. I think that when you're in those sorts of situations, you discover that most people want the same things. Most people are good. Most people want to look after their families and look after other people and can do things. And so bottom-up approaches would be my argument, that in addition to saying the government should do this for me, that we can in our communities talk about some of these issues and take some steps ourselves. And every little step, of course, adds to a bigger program of change over time. So, I still have some faith that can be helpful.
Thanks, Paul. Len?
Jess, there's a lot of hope. There's a lot of hope. There might be quite a bit of despair, but there's a lot of hope. And out of that hope, I genuinely believe what the Reverend Tim said a little earlier, and I think if we can respect individuals, if we can respect whether it be gender, disability, whatever else, at our local level in the first place, and then looking nationally and internationally to relationships. Relationships don't cost a huge amount in the first instance if we're sensible about them. And I must give a tick to some members of the current government who have done a lot of globe-trotting early. Right or wrong, there are things that should be done. So relationships at a one-to-one level, respect each other, but respect the rest of the community out there.
Great advice. Thank you, Tim.
Yeah, you've just stolen my talk, Lynn. Absolutely. I think relationships to creation, nature, relationships to one another. You know, Australians do travel, and compared to Americans and others, I see a whole lot of Australians having a go, giving generously. When I talk about the government giving in the Horn of Africa, and they go, not our region, I keep reminding them that nearly 70% of giving by Australians to a number of the big international charities here is to Africans. We actually do have this strong sense of we can do something. It's not just pointing a finger at government. And I think that's because lots of Australians have travelled. And they go, what would that be like if I was born on that latitude? So I think perspective, that sense of self-insight, that sense that relationships can be built at a very personal level, and we can all do something.
Thank you. And Eric?
I just feel since I've come back that Australia is the most siloed and individualistic place I've been in a long time. And I lived in Papua New Guinea, which is super community, family focused, and then the Middle East, which is super, actually surprisingly communitarian, particularly Arab societies, and I have just thought, no, we're not going to do that. We're going to live the kind of life where people just come to our house and, say hi, and we're going to share veggies and herbs and things like that. I just think there's so much you can do to be conscious and connected to your community. And the theme that's coming through, I'm going to say it as well, because relationships matter, and you have to be outward looking. And then once you care, then you can actually change things. And I feel like there's a lot to do if you engage. And maybe you pick one issue to engage in and make that the thing that you're going to connect with. But connection, and it just means so much to you, and it actually works. It actually changes the world.
Absolutely.
You bought a house yesterday. Are you inviting your neighbours over to share the veggies?
Everyone come. We're moving to Glen Alta. So
Fantastic.
Yeah, that's right. Yeah.
Ladies and gentlemen, like you, I feel like we could talk for a lot longer with this incredible panel. I'm so privileged to be a part of this and to be able to talk to these gentlemen. Could you please thank our panellists, Reverend Tim Costello, Professor Paul Arben, Professor Len Nataris, AO, and Eric Torbrick for talk chair.